To be continued. Then after that, I using pulse dilatation by NSC, and doing a last step was a flaring of the proximal stent, and then as you all see the artery become opened with distal myocardial blush grade is acceptable, maybe grade 3. So what about the story behind this? Actually, there's a funny story about this. I don't know why to explain or how to explain what's happened and why the inverted grayscale was helpful than a regular angiography. For that, I seek to ask one of my friends. He's an assistant professor of ophthalmology in our university. I told him about this story and trying to find any answer about some kind of visual errors, but actually my friend didn't help me. So I started to go through searching in the review of literature to find any answer about what this kind of visual modification. So I find this funny story about Galileo delusion. This story told that Galileo was puzzled by the fact that the appearance of the planets depend on whether one looked with the naked eye or with the telescope. Viewed directly, planets seemed expanded and had a radiant crown, which made Venus look 8 to 10 times larger than Jupiter. Even so, Jupiter was 4 times larger. So Galileo realized this size illusion was not created by the object but by his eyes. He didn't understand why or how. Only now with Kremko and the colleagues' new study has finally zoomed in and illuminated the scope of the problem. It is a feature of how we see everything, no less. By examining the responses of neurons in the visual system of the brain to both light stimuli and dark stimuli, the neuroscientists discovered that whether dark stimuli result in a faithful neural responses that accurately represent their size, light stimuli, on the contrary, result in a nonlinear and exaggerated responses that make the stimulus look larger. So white spots on a black background look bigger than same-sized black spots on white background. By this analysis, I could declare that sometimes we cannot clearly distinguish the small coronary channels and the stumps by regular and geographic black on white background picture better, and if we inverted the mode, we could distinguish that channels easily and clearly. Maybe that is an uncommon visual error in our eyes and unknown to most of us. So finally, to conclude, optic lesions are still challenging lesions during BCI. Inverted grayscale mode road mapping of coronary angiography is recommended to be utilized as it may help in seeing small stumps and channels or starting the integrate approach for wire crossing through totally occluded arteries, especially optic lesions. Concept of optical diversities between black and white backgrounded angiographic pictures should be investigated by ophthalmologists, as it may be an important checkup for operators as it may affect their performance inside the cath labs. Thank you.